Hello, dear friends. I am with you, Sofya Dorinskaya. I am a psychiatrist and the head of the Medical Information Center. Today, I would like to once again address the parents whose children are prescribed antipsychotics. My friends, antipsychotics are killing. Neuroleptics, any typical or atypical, have no treatment mechanism. Neuroleptic, in essence, it is a neurotropic poison that poisons the body and thus makes it depressed and apathetic. Here, I think it is worth talking about how all toxic substances affect the body. The effects of these substances are dose dependent. If the dose is small, if the dose is very small. When it enters the body accumulates it, gathering all its strength to eliminate this toxin. And the person feels a surge of energy, heightened perception, and for some, even their hearing, taste, and so on become sharper. They feel a kind of vigor. This is what happens when a small dose enters the body. Speaking of toxic substances, if the specific dose of poison that enters the human body is significantly more substantial, then under its overwhelming chemical influence, the poison makes the body sluggish and apathetic. A person feels sleepy, loses all desire, their metabolic processes slow down, they don't want to go anywhere, and lethargy sets in. This is the effect of an increased dose of poison. If the dose of poison is too large, the person dies. Absolutely all poisons follow this pattern of affecting the body. Poisons. Why do we drink coffee? Why does it make us feel alert? Because it really does contain a certain substance, caffeine. In the small dose found in a cup of coffee, it has a stimulating effect. That is, as the body eliminates this caffeine, metabolic processes increase. The body sort of wakes up in the morning, right, and becomes more energetic. A healthy flush appears on the cheeks. You immediately want to do something. Your head is full of plans, and so on and so forth. Experiments with coffee. I strongly urge you not to conduct them, okay? But if you drink several cups, you will reach a point where you want to sleep. Students, for example, who live on coffee, and during exam periods you drink a lot of coffee, and instead of sitting down to study, even though you had a burst of energy, you end up going to bed. So you drink coffee and then go to sleep. This is exactly that very effect. When the dose exceeds that small amount, the body actively starts to eliminate it, and the body already wants to sleep. But if the dose is even higher, the person will die. Neuroleptics work in exactly the same way. I'll tell you even more. Right now, there is one rather old neuroleptic. Drug addicts have started to use it in order to catch that drug-induced high. I would have never thought in my life that this neuroleptic could be used for such purposes, but addicts have figured out how to do it. Why? Because they take a small dose. Some addicts, they're practically professionals. They know all about these substances, how they work, and so on. But they take this neuroleptic and they reduce the dose to the point where it doesn't make them sluggish, but instead causes those visions, that high as they call it. And this is a completely old neuroleptic, which is still used in psychiatric hospitals today, and not just in hospitals, it's prescribed to people everywhere. And for example, people who have been in psychiatric hospitals for a very long time, it turns out also use this neuroleptic to experience these visions. A small remark? The body can get used to a dose of some kind of poison, and in order to produce a vivid sensation of improvement, the dose has to be increased. These are the so-called addictions. So, neuroleptics, their dosage is calculated to poison the body just enough not to kill it, but to make it sluggish and apathetic. There is absolutely no mechanism for treatment in neuroleptics in principle, because in order to cure something, you first need to get to the root cause of the condition. Neuroleptics are prescribed to children for various reasons. Some are disobedient in class, some have developmental delay, insufficient development, but all of them are prescribed these neuroleptics. Honestly, it's hard to understand the logic of these doctors. But I want to warn you, neuroleptics are poisons and they kill. Recently, the mother of an 11-year-old girl wrote to me. This girl was diagnosed with schizophrenia at the age of 2. What kind of idiot can diagnose a child with this at age 2? And the girl was prescribed neuroleptics. And for 7 years, she was fed these neuroleptics. And this year on Easter, this girl died at age 11 from taking neuroleptics. On February 26th, we established the Day of Remembrance for Victims of Psychiatry. This date was chosen because on this day, Katya Kovaleva, a 16-year-old girl, died. She died in the Solodovnikov Psychiatric Hospital in Omsk. At the age of 13, this girl, following the general trend to lose weight, went on a diet. And she stopped eating, as girls often do. They stop eating and so on. And she developed starvation-induced hallucinosis, meaning she experienced sharp abdominal pain, and then she started hallucinating. This is called starvation-induced hallucinosis. The psychiatrists in Omsk couldn't think of anything else but to admit her to a psychiatric hospital and start treating her with antipsychotics. The girl complained to her mother that she felt unwell while she was in the hospital because of the antipsychotics. Her mother went to the doctors and told them that Katya was feeling bad. The doctors said she was making it up and just didn't want to take the medication. And at the age of 16, while in the psychiatric hospital, this girl died at night. Her tragic story is available on our website. During her last hospitalization, Katya started feeling unwell. According to the girls who were in the ward with Katya, her mother learned that the day before, her daughter had fainted and was vomiting, but the medical staff took no action to help her. At night, her friends heard that the girl was struggling to breathe and called for the nurse on duty. Their call for help was ignored, and in the morning, Katya was found dead in the ward. My friends, remember one simple thing. If you give your children neuroleptics, in the end, they will kill them. There is no other outcome to taking neuroleptics. I want this to be absolutely clear to those people who, in one way or another, push children to take neuroleptics. These are certain teachers who, because of a child's bad behavior, and this behavior can have many causes. It could be illness, it could be constant hunger, because the way they feed children in schools now is just terrible. It's not worth anything. A child might be in a bad situation. He might simply come from a poor family and in general not get enough to eat. Nowadays, teaching in schools is sometimes terrible. And with those teachers who don't know how to teach, the children act out from not understanding, because misunderstanding builds up. Because a hungry and physically ill child is sitting in class, he doesn't understand what's going on at all. And of course, he starts to misbehave. So if teachers kick out such a child instead of sitting down and figuring out his situation, as a professional working with children should, as a professional who is obliged to be able to teach, to understand, and who must be able to see the potential in every student, they are failing their core duty and professional responsibility. When his student doesn't understand, he is obliged to be able to repeat old information for him and make sure that he understands. So instead of all this, when you start pressuring the parents to take their child to psychiatrists or to these commissions, psychiatric ones, and you know that in the end they will be prescribed neuroleptics, you are contributing to the destruction of this child. There are absolutely no disagreements with this thought. There are not even any branches away from this action. There are no justifications for this action. When you insist that a child be given neuroleptics, you are contributing to the poisoning of that child with neurotoxic substances that will ultimately lead to their death. I want every psychiatrist and neurologist to remember this. Children come to you with various problems, and you prescribe them Sonopax, you prescribe them, I don't know, a whole bunch of other neuroleptics. I want you to remember one simple thing. What are you doing? You are poisoning these children. You are not professionals. You do not know how to work with psychosis. You do not know how to look for the causes of these psychoses, and you do not know how to resolve psychosis. You are poisoning children. And these children will eventually die because you poisoned them. I want you to remember this absolutely clearly and distinctly, and that you have no doubts about what you are doing. I want every parent whose doctor gives them a prescription for a neuroleptic for their child to know absolutely for sure. To understand who is in front of them. In front of them is the person poisoning their child. I want you to know that when a teacher tells you that your child should take neuroleptics, the person in front of you is someone who wants to poison your child. There are absolutely no more discrepancies on this matter. Dear parents, neuroleptics kill. I hope that after watching this video, you will remember this and never in your life allow anyone who tries to prescribe neuroleptics to your child near them. I am a psychiatrist. I know what I am talking about. This was Sofya Dorinskaya with you. All the best. Goodbye.